When we think of ME-CFS, we normally think of things like its cardinal symptoms of exercise intolerance or post-exertional malaise, or things like dysautonomia or issues that might be going on at a cellular level. We don't tend to think about problems that might exist in the spine, how those problems might contribute to issues within the illness, or how those problems could even be used as a diagnostic tool to say whether or not someone has ME-CFS. In this video, I'm going to be talking about how the spine can be a big clue for what's going on in conditions like ME-CFS and long COVID, and how treating it using osteopathy could potentially improve people's condition. I'll also be talking about my own experience with 10 osteopathic sessions so far this year, in order to try and improve the situation with my spine and my condition. But before we get into that, if you're new to this channel, this is a place where I discuss research into ME-CFS in order to offer simplified explanations of it so that people can be more empowered into understanding their illnesses better. It's also a place where I talk about my own treatment strategies in order to improve. If that sounds of interest to you, please do like and subscribe. So what is osteopathy? Osteopathy is a kind of manual technique which works on dysfunctions within the spine and posture in order to improve the structure of someone's body. And the core idea of osteopathy is that the function of the body depends in significant part on how its structure is. So if everything is nicely aligned, then everything can flow better in the body, the fluids can get around better, and the whole body can function better. It's particularly concerned with improving the functionality of the lymphatic system. The lymphatic system carries the lymph fluids all throughout the body and, under normal healthy circumstances, is able to eliminate toxins from the body very efficiently. Now, one might reasonably ask, what can this all have to do with ME-CFS? And this is where Dr. Raymond Perrin comes in. Now, Dr. Perrin is an osteopath, and some decades ago he came across his first ME-CFS patients, and he noticed a certain pattern across all of them, a certain kind of dysfunction within the spine. And in particular, what he found was that in the thoracic region, which is the region pretty much from the base of the neck down to the level of the diaphragm, and what he found was that in all of his ME-CFS patients, their thoracic spine was rigid and painful. And when this part of the spine is like that, it basically means that the fluids in the body, the lymph fluids in the body, become stagnant. So the lymph fluids then, when they're stagnant, they are not flowing adequately through the body, they're not eliminating toxins. And what happens is the fluid actually starts to get backlogged and it flows back into the brain. And this then causes a buildup of toxins in the brain. And when there are toxins in the brain, these start to freak out the nervous system and contribute to, or even cause perhaps in some cases, the sympathetic flight or fight dominance that is so characteristic of ME-CFS. So this is an anatomical, physiological, structural way in which the dysautonomia in ME-CFS can be caused or contributed to. So often people just reduce this issue just down to the a neuroplasticity problem, something that can be affected, brain retraining, for example. But this is another example of how actually something structural can be freaking out the nervous system. In addition to the rigid thoracic spine, Dr. Perrin also expects to find varicose lymphatics in the chest region, which is you'll have tender veins in the chest, and also a tender point called Perrin's point in the top left, just above the sideways under the left armpit. And this is due to the build-up of the lymphatic fluid. And so having found this in his ME-CFS patients, he proceeded to modify osteopathy in order to treat these patients more effectively. And as a result, he developed the so-called Perrin Technique. And he has since written several books about this in various editions, which I have read. And he has also trained hundreds of osteopathic practitioners around the world in approach to treating ME-CFS. So you can find, if you go to the Perrin Technique website, a map with the osteopathic practitioners who have trained in the Perrin Technique. I should note that that map does not seem to be up to date. So if you look through the news section of the Perrin Technique website, you can find additional practitioners around the world. And so Dr. Perrin actually went further than this and was part of a study published in the British Medical Journal. And what this study was looking at was whether if you take a group of ME-CFS patients and you present them to specialists who don't know whether or not those patients have ME-CFS, but who have been taught about the spinal problems within the condition, can you actually accurately diagnose the patients who have ME-CFS or not? And what Dr. Perrin's study found, with the title, Can Physical Assessment Techniques Aid Diagnosis in People with Chronic Fatigue Syndrome / Myalgic Encephalomyelitis, a Diagnostic Accuracy Study, what he found was that indeed it could. In the vast majority of ME-CFS patients, they were correctly diagnosed simply based on the physical signs of their spine and posture. Now that's quite mind-blowing, really. This leaves me with so many questions, really. Why do ME-CFS patients have these problems in the thoracic spine? What could be the contributing factor that means that everyone is presenting in a similar way? Do they get so stressed by everything that their spine responds to that? Is it something to do with connective tissue disorders which might cause laxity in the spine and change the posture? I've really no idea as to why it is that this is something that is similar across the board. But in any event, it seems to be the case, and therefore treating these problems could be very helpful. And let's think about what the rationale might be there. If you can actually get the spine back to normal, then you could allow the lymphatic fluid to be flowing normally throughout the body, and therefore the body will start to eliminate the toxins that have built up throughout the system and in the brain, and therefore the brain can start to balance itself better between sympathetic and the parasympathetic state, which is so crucial for improving and healing from ME-CFS. So it seems to me that this is an important part of the puzzle. So at this point, I'm now going to switch to my personal experience. I've been interested in the work of Dr. Perrin for a long time, and I long suspected that these kinds of spinal issues applied to me. Now, there are no Perrin practitioners near where I have been living, but there have been osteopaths. And so at the beginning of this year, I decided to go to a local osteopath in a small French village, explain to him my situation, bring along the Perrin Technique book, and say, look, do you think that these problems apply to me, and can you still treat me? Because, of course, osteopathy is essentially what the Perrin Technique is based on, and so I think it can be valid for any decent osteopath simply to look at your situation and treat from their point of view. And so he listened to my story, and he was interested in the book, and then he examined my situation and said, yes, all the things that you've told me about what Perrin says apply to you, but a whole lot more as well. And what he actually said to me was, to look at your back, I would think you had played rugby for 15 years and that you'd been in 3 car accidents. So that was very encouraging. But I had 3 sessions with him back at the start of the year. By the end of the 3rd session, he already said to me, all of the car accidents are gone, all of the rugby is gone. I had a very profound improvement from those more severe issues after just 3 sessions. And the reactions that I had to those sessions were pretty intense. An osteopath is gentler than a chiropractor, but it still leaves you absolutely wiped afterwards, and it can be hard to believe that such manipulations can have such an effect on you. But I would feel very woozy in the head, I would feel very kind of like woo, like that. I'd feel the lymph fluid moving throughout my body, through my brain, and I'd just have to lie down. After the 2nd session, the reaction was extremely intense, and it actually involved I've had this leg length discrepancy for many years, and my right leg started to descend towards the ground. It started to lengthen, and the result of that was that I was loading throughout my whole body in a new way, and then I just became, every bone in my body ached as it got used to the new way that I was walking around. So it was very powerful, and I was very encouraged by it. And then I went to a different French town, and I got a new osteopath for 4 sessions. And he continued with the work, and I continued to notice improvements, my spine becoming more flexible. Again, after each session, this feeling of wooziness in the head as the lymph is getting stimulated. And that continued to improve me, and then I went back to where I was living before, and I had another couple of sessions. Again, noticing these improvements. And the situation with my spine now, after 10 sessions altogether this year, is that it's significantly, more flexible, and I do feel that my condition has improved. What I find particularly interesting is that the feeling of the lymphatic system being stimulated after a session, moving around and so on, is actually quite similar to how I sometimes feel when I'm ill. And so it makes me think that this stagnation of the lymphatic fluid is indeed part of my condition, and that improving it is helping me. I think it's particularly helped with my sleep. My sleep can be a real issue at times, but I feel that this year it's been consistently better. And I think it's perhaps because things are just working better in the brain through these treatments. There was also an interesting treatment I had a few months ago where it actually resulted in pimples breaking out on my face, which presumably would be the toxins being released, and also an increase in sensitivity to noise and light. I felt intensely hungover at that particular treatment, and so that also really indicated to me there's something going on here with how the lymph is contributing to the nervous system dysfunction. So where does all this leave me? Well, despite the progress that I've made with my spine, I rather suspected that I still had a long way to go with improving it. So what I wanted to do was I wanted to go to see France's only Perrin practitioner, Dr. Vincent Staff, in Bordeaux. I arranged an appointment with him and I booked several months in Bordeaux in the hope that I could have regular treatments with him and he would completely sort me out. So I went to see Dr. Staff last week, actually, for my first appointment with him. And he's extremely impressive. He runs Bordeaux's Osteopathy clinic. It's an extremely impressive setup. And he's clearly a very knowledgeable person. And I felt immediately that I'd be in good hands with him. What he said to me upon examining my spine is that indeed the situation is still very rigid, kind of throughout, but particularly in the thoracic region, where he says there are 5 particular blocks that need to be resolved. And he looked at me and I could see he had genuine sympathy. He said, there's no wonder that you have these issues with post-exertional malaise, because your situation is such that, the body fluids are going to be very stagnant with you. Now, what he wanted me to do is to get an X-ray to make sure that there's not actually a developmental reason in my teenage years that might actually have made my spine dysfunctional, and he'd want to know that before manipulating the thoracic region in particular. Unfortunately, because he's top dog, the availability is limited, and I was only able to get one more appointment in the time that I'm here. So what I'm planning on doing is coming back to Bordeaux in the autumn and winter to continue treatments with Dr. Staff when he can see me once a month, and in the meantime I'll crack on with another osteopath as well, just to keep up the momentum. But anyway, that's my situation at the moment. So I have made significant progress with these problems in my spine. I have noticed an improvement in the functioning of my nervous system as a result. I do believe that my sleep has improved as a result, and I do think that this is actually an important part of the puzzle. Obviously, there are so many things going on in ME-CFS. You cannot reduce it down to any one thing. There's blood volume, autoimmunity, microclotting, cellular issues, dysautonomia in a more conventional way that might be amenable to brain retraining, etc. There's so many things happening. But this seems to be an important part of it all. I never would have thought to explore something like this before, but illness can lead you in unexpected directions. So I will continue on with this osteopathy, and later in the summer I hope to publish another update video about how I'm doing with it and whether or not it seems to be helping me. So I hope you found this video of interest. If you want to learn more about me, please head over to my website, patrickusher.com, where you can find my various books on POTS, on Thurston, ME-CFS and long COVID, as well as my consultation service. Have you had problems with issues in your spine? What do you think about this kind of approach? Have you seen an osteopath? Have you seen a Perrin practitioner? Do leave your experience down below.